Hi everyone, it's Dr. Charlotte Hodges. I want to go over a little bit today some more of my topics from my patients that you guys wrote into me about. And actually today is all about carbonated beverages, straws, and can my stomach pouch stretch out? It's actually a really common question that I get a lot. I do a lot of revision surgery in my practice. Maybe 30 to 40% of my practice is revision surgery. But then I also have patients they're coming in for they have virgin bellies and they're coming in for their first sleeve or their first bypass, and they're concerned, they hear, oh, if I do this or that, my stomach is going to stretch out. So old wives' tale number one, if you drink carbonated beverages, it's going to stretch out that stomach. Not gonna happen. Not gonna happen. So this is what you need to know. The walls of your stomach have a lot of elasticity in them, okay? There's several layers of muscle and you have a lot of elasticity. When you initially have your surgery and you're cutting on the stomach, and that's regardless of whether you had the sleeve, the bypass, the switch, or revision, the natural healing process causes inflammation. Think of it, whenever you jam your finger into a drawer or you stub your toe and things swell up and then you're like, I can barely bend my finger. The same thing is happening inside your belly. So the walls of your stomach are going to be very stiff initially when you first have your surgery. In fact, if I were to put a camera in your belly, like a little laparoscope, and I did not know that you had ever had any surgery before, I could tell just by how tough or what the consistency of your tissue feels like as to how long you've been out from surgery. If you have nice, normal, pliable tissue, I know it's been months and months. But if you have kind of boggy, tense tissue, almost like, think of like a croissant that's full of butter and jam, it's kind of goopy and kind of tense like this, then I know that you're fresh out of surgery. So that is why initially when you have these surgeries, when you first try to drink, you're not going to have a lot of elasticity or a lot of distensibility into your stomach, so you're not going to be able to tolerate very much at all. Over time, the inflammation goes down, things heal, and you're going to get more distensibility to that stomach, so you'll be able to tolerate more. Now, so does that mean that you can eventually cause your stomach that was made either this big or that big if it was a sleeve, that it's going to now stretch out? The answer to that is no. In my practice, certainly I can tell you that whenever I've done revisions on patients that have had old bypasses, old sleeves, patients that have had a lot of excess tissue, it is not because they've stretched it out. It's because it was just originally made too big. Back in the day, stomach pouches were made a lot bigger. And then there are also quite a few surgeons I know that whenever they perform their sleeves, they leave a lot more tissue up at the superior portion of the stomach in an effort to help decrease the risk for leak, because that's where most leaks happen. So the idea is if I leave more tissue, then there'll be less tension on those sutures. And so by giving your stomach a little bit more give, you'll have a decreased risk for something to kind of blow open. I am not of that thought. I want to give you a good restrictive procedure. So if you're getting a sleeve from me, you're not going to have any redundant tissue up at the top. There's not any drink or food that you can consistently take in that is going to cause your stomach to expand, okay, and to kind of stay large. Now, that can happen to your esophagus, and it is not uncommon for me, especially with patients that had previously had a band, for them to have a big floppy esophagus, and your esophagus can sometimes serve as a little neo stomach. Like you swallow, you take in big bites, it kind of gets backed up in the esophagus, and then it slowly, almost like a funnel, goes down into your little stomach pouch. Well, your esophagus can expand pretty large before you start getting those feelings of pain. And your esophagus is not going to have those different sensors that your stomach does that tells your brain, hey, I'm stretched, you're full, stop eating. And so the walls of your stomach are full of those pressure receptors, those baroreceptors that give the signals to your brain to let you know that you're full. Your esophagus does not have those. So if patients are eating a lot, it does not surprise me if food is backing up into their esophagus somewhat and it's slowly making its way into their stomach pouch. Your esophagus, unlike your stomach, does not have all the different layers that your stomach does. And so your esophagus can be a bit like a pair of pantyhose that get shot. I mean, your esophagus can get big and it can get floppy. That can definitely become really big, but typically your stomach pouch won't. So what does that mean for patients? Does that mean that you can never have carbonated beverages, or why do people say this? A carbonated beverage is going to make you feel fuller just because of all the carbonation in it. But just like for me, I haven't had surgery, and if I went to Amarillo and I tried to eat that 72-ounce steak, there's no way that I could do it within an hour. But if you gave me all day, I could pick at it all day. That is what's happening with most of my bariatric patients when they're beginning to feel that they're having some weight gain. It's not necessarily that they're eating an entire pizza. They're certainly not doing that all at once. And I don't mean pizza, it could be anything. But typically what it is, they're going to lunch or they're going to dinner. They can't eat everything because they have a small stomach. They bring back the leftovers and then they pick, either for the rest of the afternoon or for the rest of the evening. Well, if you do that, you might as well not have even had surgery because you're taking away that entire restrictive component of the surgery. Your body does not care if it takes 1 hour or 5 hours to get in that high calorie meal. If you're picking little bits at it all throughout the day, you're going to get it in. And it does not affect the size of your stomach at all. Okay? So does that kind of clear things up a little bit? Initially, you're going to feel like you can't tolerate much, and that's just because that's a normal healing process. And the normal healing process can last anywhere from 6 to 9, sometimes even 18 months. That's why you're never going to feel like you did the first month after surgery. Kind of like that golden time when you're like, I can only tolerate 1 tablespoon of food. Yeah, that is only in the beginning, and that's because you're healing. If you want to make sure that you don't begin to regain any weight, there are 3 things you need to do. Number 1, watch out for your liquid calories. Again, you might not get in that big gulp all in one time, but you certainly could suck it down if you have the entire day. So watch out for liquid calories. So even if it's high calorie protein drinks, you're adding everything in under the sun, your yogurt, your almond milk, your chia seeds, your fruit, this, that, and the other, you may end up making your 200 calorie protein shake now 500 or 600 calories. And again, it doesn't matter if you can only get it in 30 minutes or it takes you all day, you're going to get in all those calories. So watch out for your liquid calories, high calorie protein drinks, high calorie sodas, sweet teas. Stop with the sweet tea. Full sugar juices, coffee drinks, alcohol. It does not mean that you can't have alcohol. Just know that there's a lot of calories. And it also does not matter if alcohol is clear. It does not matter if you have vodka over bourbon. Guess what? There's still calories in vodka. So it doesn't matter that you can see through or that your vodka is clear. There's still going to be calories in it. And for most liquors, it's about 100 calories per ounce or per little shot. So liquid calories, if you snack on a bunch of crunchy snack foods throughout the day, that's going to be chips, popcorn, pork rinds. I don't know why everybody thinks it's fine to eat pork rinds. Pork rinds, crackers, peanut butter crackers. OMG, peanut butter crackers are the bane of my existence. If you want to do a protein supplement, it's not going to be in peanut butter crackers, okay? Those are really, really high in calorie, and you're getting very negligible amount of protein. So watch out for all those crunchy snack foods. Those are going to go down really easy. They mostly get absorbed in your mouth. In fact, in your GI tract, you have a little enzyme called amylase. See, all of y'all are going to get all these answers on Who Wants to Be a Millionaire or Trivial Pursuit. So, what is the enzyme that can digest simple sugars that is in your mouth and throughout your entire digestive tract? That would be amylase. It does not matter how much bowel I rearrange. If you eat a simple carbohydrate, like you're sucking on a lollipop, or you're eating candies, or you're eating Tootsie Rolls, or anything real, even lots of fruit, all that is going to get absorbed. It's going to start the absorption process in your mouth. And so even if you have that small bowel rearrangement, your food limb that hasn't mixed with all of the digestive juice, that food limb still has amylase, and you're still going to begin that digestive process for those simple sugars, and your body's going to be absorbing all those simple sugars if you're eating a lot of simple carbohydrates. So watch out for the simple carbohydrates. And then also watch out just for grazing as a general rule throughout the day. Have breakfast, lunch, and dinner, 1 or 2 snacks. Make sure you're doing your protein supplement. I think whenever people go and see their trainer and their trainer's like, I want you to have 6 meals a day. For them, what they mean by a meal is 150 to 200 calories. That's not what I consider a meal. That is a snack. However, that's typically what they are referring to. So it's sometimes knowing the nomenclature. For instance, when I say, what is your diet? I don't mean, are you on Jenny Craig? Are you on Weight Watchers? I mean, what is the regimen of food that you're eating? That's also what they're referring to. So I feel that patients definitely have a tendency to take in way more calories if they graze throughout the day. So breakfast, lunch, and dinner. Watch out for your liquid calories. Watch out for crunchy snack foods. Oh, and one other thing. I do not care if my patients use a straw. Can a straw introduce excess air? It can, but if you feel real gassy, just take some Gas-X. I think it comes in like in the little strips. It works great. It's even the little drops that you give babies for colicky bellies. It's just simethicone. It's all the same thing. It's just Gas-X. So you can do it like in the little chalky chew. You can do it in the drops. You can do it like in the little strips that look like a dentine strip. So I don't care if patients use straws before surgery or after surgery or in the immediate postoperative period. So I hope that this helps you guys. Certainly, if you're going to do a carbonated beverage, make sure it's calorie free. Also know that a lot of the artificial sweeteners can increase your carbohydrate craving. I know I love my Diet Cokes, but if I tend to drink a Diet Coke, I will have more sugar cravings. But sometimes I just have to have my Diet Coke. And my husband, he's our psychologist. He had a bypass a million years ago. He loves his Coke Zero. So don't think that it's the carbonation in your diet drink that is causing you to gain weight. It's probably the grazing that you might be doing throughout the day, all the simple carbohydrates, or some of these other bad habits that you may have fallen into. Your stomach is not stretched. I've done hundreds and hundreds, well over 1,000 EGDs, and I can tell you, you have not stretched out your pouch, okay? It's just gonna be some of these daily habits, and that's why it's so important for the first year that you try to instill some of these good eating habits so that you can have good long-term success. So, the myth, does carbonated beverages cause you to stretch out your stomach? The answer is no. However, there are some things that you can be doing on a daily basis that might put you at risk for gaining weight. So I hope that this has helped and had been insightful. Please feel free to share this with your friends. Give me a thumbs up and don't forget to subscribe. Bye.